Is addiction a disease? What happens after long-term exposure? Is addiction a disease? Do people recover? Well, of course people recover from addiction. Those are the stories that are so rich in so much of what you do and in the lives of the people that I interact with, the stories of recovery. And there's so many different pathways for people to recover. There's self-help, there's treatment, of course. There's some people just stop. Some people never stop. I still remember the trach tube veteran. Some people never stop. And so is it a disease? Absolutely. We still in the country don't focus as much on it as a disease as we should. It is a chronic relapsing disease. The science is clear. We still want to treat addiction as if it was a broken leg and someone goes into rehab and 28 days later they come out and they're all fixed and it'll never happen again. But that's not the way we can look at it. We have to look at it as a chronic, relapsing disease that it is, like diabetes. Diabetes has a huge behavioral component. Lung cancer, I do a lot of judicial training. I had a judge once say to me, and I'm trying to convince him this is a disease, that the people come before him. He said, "You're never going to convince anybody, never, that it's a disease. Everybody knows diabetes is genetic." And I knew he had that raspy voice because he was a smoker. So I started asking him, well, what about lung cancer? What about it? I said, we'll take out people's lungs, we'll irradiate, we'll use chemotherapy. We don't think twice about providing that kind of appropriate care as long as people need it. And let's hope that's going to be true in the new decade. And yet, we do that with addiction. So it is a disease. The data is clear. And we really need your help to really get that information out. And I want to thank you.